Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're visiting a Lowcountry bariatric surgeon to talk about a weight loss procedure that uses an endoscopic suturing device to reduce the size of a patient's stomach.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Washington, and we're talking about a new procedure when it comes to weight loss. First off, I have to say, you're one of my favorite people to come and talk to as far as Medical Monday, so thanks for having us.
Thank you.
Okay, so let's talk about this new procedure when it comes to those having difficulties with weight loss.
Yeah, so we have a new procedure, well, a new therapy. We call it endobariatrics. And basically, we can now do, a weight loss operation per se all through the mouth without any incisions. So it's actually incisionless or non-surgical weight loss. It's particularly applicable to people that have a BMI range between 30 and 40. Previously, those people always felt that diet and exercise and medications fell short and they couldn't achieve long-term weight loss. And then they felt that formal bariatric surgery was too radical for them because they weren't that overweight or not that sick from their obesity. So now we're able to offer something in the middle of the road that's done ambulatory, that's done with an endoscope, and it's extremely minimally invasive.
Okay, so is this kind of like in the area of like robotics almost? Like I'm learning that that's becoming a huge thing in all different areas of medicine.
Well, robotics is surgical.
Okay,
so we use robots to do bariatric surgery.
Okay, so when you're going through the mouth, how are you making it happen in there?
But now we have a device that goes on the end of an endoscope. Endoscopes are used, for your colonoscopies, to examine your upper GI tract. Endoscopes have been around for a long, long time. But now they have devised a device that goes on the end of an endoscope that can actually place sutures in the GI tract.
Okay, so like, what does that mean? Like you're closing?
So we can stitch.
Okay.
We can stitch inside where we could never do that before.
Okay, so in the past though, was this maybe a time where people would have done like a lap band, and now this is taking it a step further and probably a better option?
Yes, well, the lap band, while has done well in that BMI age, in that BMI range of 30 to 40, and I think that's where it was, best suited. It does require, frequent follow-up for adjustments, and it does have a high complication rate in that many patients that have had lap bands had to have reoperated on for something that's gone wrong because it's a implanted medical device. So lap bands aren't that common anymore because many surgeons feel as if they're too problematic for patients, requiring frequent visits to the office and always the chance of requiring a reoperation for a device malfunction.
Okay, so when you do bariatric surgery, and we've learned this before, I mean, that's a big surgery. I mean, it's safe these days, but I mean,
Well, bariatric surgery has been safe. They now say it's, safer than a gallbladder, which is a very common operation done every day. But it is an operation, and it, requires, general anesthesia. You're in the hospital usually, overnight, if not for 2 days. And bariatric surgery is somewhat a permanent alteration of your anatomy.
Oh, okay.
Okay, and for most of the operations, there's no going back. And these operations are, they decrease the size of the stomach endoscopically, and they're not surgical, and there's no incisions required, which some people that are in what we call the class 1 and class 2 obesity, not severe obesity, are more inclined to do these because they're not a surgical procedure.
Okay, so let's say you get this surgery, you go ahead, are you like walking the next, like right after it?
So it's ambulatory, you go home the same day, okay? And the next day, of course there's a little bit of a diet progression. You're not gonna start eating regular food right away. We're gonna have you on, liquids for a little while till you accommodate to it. But these procedures, they decrease the size of your stomach by actually suturing it and pleating it inside. and give you a feeling that when you eat small meals, you get full very quickly, enabling you to lose weight.
But bottom line is, no matter what, lifestyle changes still have to occur,
Yes,
right?
of course. Even when we do these procedures, it's a whole comprehensive program where our dietitian is involved and support groups are involved, because none of these operations, whether it be formal bariatric surgery or endobariatrics, work if you do them in a vacuum.
Gotcha. All right, well, Dr. Washington, as always, a pleasure chatting with you today, so thank you for having us.
Thank you.
And for more information, you can always head online to eastcoopermedctr.com.